When I was asked to speak today, I welcomed the opportunity to talk about local data with regard to TB. And Alice Turner, the coordinator of this event, kept asking me if I knew anyone who could speak about their personal experience with active TB or latent TB infection. And about 3 conversations in, I finally said, okay, Alice, I have my own personal experience of an occupational exposure to tuberculosis that occurred when I was in nursing school. And my hesitation stemmed from being, remembering back to that time and how frightening that was. And I can honestly say those 24 hours from the time they told me I had a positive tuberculosis skin test to the time that I found out that actually I was not an active case but latent, was probably the most harrowing 24 hours of my life. And I'll just share a little bit of that experience with you. I was in nursing school. I was in my 2nd year. My 1st year, I had had a TB skin test that was negative. And the 2nd year came around, and as with a lot of occupations that are at high risk for exposure, they ask you to get an annual TB skin test. So I went trotted down to our local public health agency and had my TB skin test placed. 48 to 72 hours later, I showed my nursing instructor that, and she raised her eyebrows, and I thought, that doesn't seem quite right. She said, you need to go have that read back at the health department. And when I was there, they read my TB skin test, they placed it on your forearm, and they measured it, and it measured about 15 millimeters. And because I was in an occupation where I could have been exposed, that was deemed as a positive TB skin test. And they sent me immediately to my doctor for a chest x-ray. Unfortunately, my primary care physician was out of the office that day, and a resident physician from Southern California was in, who was not accustomed to reading chest x-rays from people in mid-Missouri. So I had this chest x-ray, and he came back in the room and politely handed me a mask and said, put this on. He said, you have active tuberculosis. Your chest x-ray is positive. And he said, and I remember very little of the next words, but I remember on my way out, he grabbed me by the arm and he said, and you'll need to drop out of nursing school today. So I went home, and I was scared for a number of reasons. One is that I have a family, and I was afraid I had exposed them. And now my career track was going to be put on hold because I was going to have to drop out of nursing school until I had completed the therapy. Luckily, as I was getting ready to deliver my withdrawal letter the next day to the school, my doctor called me and said, I'm sorry, that doctor is from Southern California and is not used to reading TB chest x-rays from people that are natives of Missouri. And in the Midwest, we sometimes have calcifications or some granulosis caused from pollens, the high pollen exposure. And he had read those as active lesions. So I'd already gone to give sputum cultures, and 10 days later, those came back as negative. So I did not have active tuberculosis. I was not contagious. But I did have latent tuberculosis infection, and I was required to take the 9 months, or the 6 months, it was 6 months of medication at that time. The medication regimen itself is not a walk in the park. It requires, I had to go down to the local public health agency. I was a nursing student. I didn't have health insurance, and I became very dependent on our local public health system to get me through the next 6 months. They educated me, and they gave me my medications at no cost. I could go back monthly, and at that time they still monitored, the medicine is hard on your liver, so they monitored your liver function tests also monthly. I completed my 6 months, but during that time they told me, limit your chocolate intake, limit your red wine intake, and there were a list of other foods that you could not eat while you were on these medications because of the way the drug is metabolized in your liver. I also experienced something called neuropathies, and that's another side effect of the INH, the medication that you take. And that is, I had numbness and tingling that would spread up through my face, and it just felt numb, and it just felt like somebody was constantly tickling me with a feather duster along the sides of my face. But they gave me, I went to the local public health agency and told them of my symptoms, and they increased my vitamin B6, which is something you also take with the INH, and that got rid of the problem. So once I finished, I was able to stay in nursing school. I did not have to quit, and but my experience was very, very frightening to me. I can remember when I left, I came back to school, and you know, it's a small town, and word had spread, and I wish they would have given me a T-shirt in my education packet that said, "I am not contagious," because there's a social stigma attached to having this diagnosis, whether it's latent or active. I think the general public doesn't understand the difference necessarily, and so people tend to spread a wide circle around me when I would approach. But that was definitely a learning experience for me. It was my first insight into our local public health system and my first dealings with that. And now I work there, and I see the importance of the surveillance and the education and the TB skin testing for those in high-risk occupations, and then also for those that are from areas where tuberculosis is endemic. That was 15 years ago or more, and I went back to look at statistics from that time, from the time that I was diagnosed, and I couldn't put my hands on any, but I do know the general trend is showing that a decrease in the number of cases, and Cole County is seeing that same trend in their cases. On average, we have 40 to 50 latent tuberculosis infection diagnoses a year, and we have 1 to 2 active cases in Cole County per year that we see through the health department. I have no doubt that the trend is decreasing because of the vigilance of our healthcare professionals and the cooperation with our local public health system. And I just want to leave you today with a quote from, I'm going to steal from Sir Liam Donaldson, from the Chief Medical Officer in England, who sums this up nicely and really tells us that we still have to remain vigilant if we are going to keep this on the decrease. He says, "Complacency is perhaps the cardinal sin for those charged with protecting public health. Infectious diseases, once thought conquered, are always marshaling their forces, ready to strike back in the face of reduced vigilance." Thank you.